Now, today marks 31 years of observing World Mental Health Day. Founded by the World Federation for Mental Health, the day is aimed at raising awareness and destigmatizing mental illness in society. This year's theme is Mental Health is a Universal Human Right, and according to the latest statistics from the South African Depression and Anxiety Group, 1 in 3 South Africans will experience some form of mental illness in their lifetime. Let's get an update on the state of this particular issue in the country. Bring in the Deputy Director of the South African Federation for Mental Health, that's Leon de Beer, who joins us via our video link this morning. And Leon, it's lovely to have you on the program. Thanks very much indeed for making time to help us think through this incredibly important issue. You know, after COVID, we were warned that we should prepare for some kind of mental health pandemic just because of, you know, the after effects of have lived through a time like that. So perhaps let's just begin by understanding the landscape in this country so far. How major a challenge is this issue, and who do you reckon needs to be prioritized?
Yeah, I mean, mental health is a great priority in our country, and as you rightly said, COVID-19 did have a tremendous impact on the mental health of everybody, really, and it really thrust mental health into the spotlight, because even people who weren't or hadn't been affected previously by mental health conditions came to understand severe stress, anxiety, depression. But it's not just been COVID-19. You know, subsequently we've had to deal with natural disasters like the floods in KZN and droughts. We've had to deal with social unrests. We are under pressure because of load shedding, water shortages, political corruption, poor service delivery, high cost of living, and that is all affecting the mental health of South Africans. So our mental health is really under pressure, and mental health experts consistently agree that despite the fact that we have policies, and we do have a new mental health policy framework in South Africa that has just been launched this year, there is a real problem when it comes to the lack of implementation, human resource shortages, and poor financing. And these all pose significant challenges to realizing the vision we have for mental health in South Africa.
Yeah. Speaking about that vision, you know, I still find that for a lot of people, discussions or, understanding mental health feels a bit elusive still. Yes, we have a whole lot more of those discussions on platforms like this, but, it's still this idea that people struggle to wrap their heads around, ironically.
Yeah.
How would you say we should explain what a mental health challenge is, because, in a conversation that Michelle and I had briefly off air, people sometimes think that mental health challenges look a particular way, where quite frankly we now know they don't.
Yeah. I mean, it's a tricky one. I think one of the things that's really important to understand, and I think this is a key message I want to put out there today, and it's part of our theme as well for World Mental Health Day, is that people need to understand that, and this is not just me speaking, this is coming from the World Health Organization, that to be healthy and to have health as a human being, we need to be both physically and mentally healthy. And those two concepts are inextricably linked to each other. You have to have good physical health and mental health to be healthy. How to define good mental health? Well, good mental health is when you're able to look after yourself, maintain a healthy, positive lifestyle, you're able to work, you're able to have good self-care, good relationships, all those kinds of things. But it is, unfortunately, I think one of the issues is still that because of the stigma attached to mental health, we are not yet seeing people coming out and comfortably talking about their own mental health and also the mental health of, family members, children, colleagues, and those kinds of things. It's really important that at all levels of society, we really encourage people to talk about mental health, because in South Africa, we have a very big problem with people accessing mental health care services. First of all, because there's a lack of resources, but also because of the fear of stigma and discrimination. People don't want to go and see a professional. So it's about dragging mental health out of the shadows, destigmatizing it, encouraging people to seek help, and then supporting people as they are on their recovery pathway.
Yeah, absolutely. One of the things that come up whenever we speak about mental health is the challenge around suicide, and not everybody who dies by suicide had a mental health issue, but again, it's just one of the things that really do come up whenever we unpack this particular topic. How are we looking insofar as that is concerned, when it comes to trends, especially because we've also been told that it appears that one gender in particular may have higher incidence of suicide than the other. Do we understand why?
So maybe I'll just start at a global level. So suicide is actually one of the leading causes of death globally. More than 700,000 people die each year due to suicide. And it's very troubling is when we look at the age range 15 to 29, it is the fourth leading cause of death amongst that age group. So that's very scary and very concerning. And also 77% of global suicides occur in countries like South Africa, low and middle income countries. But you touched on something really important, and that is that so there was at a particular stage, there was a study done, and of the just almost 14,000 suicides reported in South Africa, almost 11,000 of those were men, and only about 3,000 were women. So there's a much higher rate of suicide among men than among women, but this is not just unique to South Africa. It is a global trend. And when we look at that 700,000 people per year, the suicide rate for men is almost 13 per 100,000, where for women it is about 5 per 100,000. So really an important topic to talk about.
Sure. And what do you reckon is left out of those discussions, if anything at all? Because I always get the impression that we just fundamentally even don't understand suicide enough, There are all kinds of voices that typically get involved. There's people who rely on faith, those who rely on tradition, others on medicine. And again, sometimes all these messages speak past each other and leave people feeling confused more than anything else if they've ever had to deal with suicide in whatever way at close range.
I mean, I think, again, I just want to come back to the issue of men and suicide. I think, again, the stigma around, that it is unmanly or it's a sign of weakness to reach out for help is something that men really struggle with, and therefore are, 5 times more likely to die by suicide than women. One of the other problems is that it goes like this. Women are generally diagnosed with depression and anxiety more than men. However, men die more by suicide. And that is due to the fact that men are more reluctant, like I said, to own up to their mental health problems, but also because mental health, depression specifically, manifests differently in men than in women. Whereas in women, you might have the typical symptoms we associate with depression, low mood, feeling low energy, feeling depressed. In men, and it often comes out in risk-taking behavior, impulse control problems, anger, irritability. So it doesn't get diagnosed and picked up as depression, and therefore men die more by suicide. And we really need to break this culture of boys don't cry and, this male kind of macho stereotype to ensure that we can save more lives.
Yeah, absolutely. I'm interested to find out what you think about what role social media you reckon has had in our attempts to get this right. Depending on who you ask, it's the best or the worst thing to have ever happened to us. But I wonder if you're able to kind of see the effects of this particular platform when it comes to raising awareness, I suppose, and ultimately eradicating mental health issues.
I mean, I think it's a dual-edged sword. I'm not a social media expert, but I think from my perspective of working in the mental health sector for a long time, I think social media, like I said, is a double-edged sword. On the one hand, it gives us the opportunity to reach more people. It gives us the opportunity to raise more awareness, do more public education. It gives people an opportunity to connect with others when they might be isolated. However, the flip side of that is, the whole thing about people only portray their perfect lives on social media. And if I'm somebody who's feeling depressed and maybe not happy with my life, and I'm constantly on something like Facebook and I'm seeing everybody having wonderful family holidays and all those kind of things, it might actually impact very badly on my mental health. So it's really, it is a double-edged sword. So it does have, positives, but there are also negatives to it, and the negatives can be quite severe.
Yeah, absolutely. The theme for this year, once again, as I mentioned at the beginning of our discussion, is mental health is a universal human right. And it was the World Health Organization's Director General who spoke about the idea that the world is also moving to a place where there's a greater acceptance of universal health coverage. What does that look like, though, when it comes to mental health, involving that in the drive, if you know what I mean?
Yeah. So so what we've done is we've taken the World Federation for Mental Health's theme and we've domesticated it for South Africa to really look at universal mental health coverage. And the reason for that is because we want to see the right to health, which, as I said earlier, includes mental health, realized for all in South Africa because it is a basic human right. So on this day, World Mental Health Day, we call attention to how universal health coverage specifically means universal mental health coverage because a person's health includes their mental health. It is important because there's a large gap in health coverage at the moment for mental health conditions in South Africa. It is estimated that less than 1 in 10 people who have a mental health condition receive the care they need. And through this, we can try and tackle this gap to integrate and expand access to what we see as rights-based, quality, evidence-based, culturally sensitive and cost-effective mental health care into universal health coverage, which in our country is things like the NHI that is on the cards.
Absolutely. On a day like this, I always like to end off by asking if there were to be anyone who's watching, wondering if they're dealing with a mental health issue, what would be your expert advice about how they should go about handling something like that?
I think if you're wondering, if you're contemplating whether you have a mental health problem, you've already taken the first big step. That's self-recognition. So my advice would be that if you are concerned about your mental health or the mental health of your friends or family, colleagues, do something about it. Be that person that either reaches out for help yourself or reaches out to the person next to you. It doesn't take anything to ask somebody, are you okay? It takes nothing away from you and you might make a huge difference. So my message would be reach out for help. Help is always available. There is always hope. And mental illness is not a death sentence. With the right care and support, persons with mental illnesses can lead productive, long, healthy lives like everybody else. So get support, reach out, get in touch with an organization such as ourselves.
Absolutely. Times have been tough for quite a while, and I imagine many people, of course, have taken a knock because of that, and this makes this discussion incredibly important. So, Leon de Beer, thanks very much indeed for speaking to us. He's the Deputy Director of the South African Federation for Mental Health on this World Mental Health Day.